Hi guys, it's me Hunter, and I'm at home and I'm in recovery from having a top surgery revision. And there's no way I'm gonna sit anywhere else right now where I'm not comfortable, so I'm sitting up in bed. And because my back is killing me, my sides are killing me from being cut open, from being gutted like a fish. So I didn't have the greatest experience. I'm not sure with the surgery itself. It was after the anesthesia wore off. I was a mess. I ended up in the ER. Um, I was in severe pain everywhere, and you wouldn't think that would happen over some minor surgery, but actually, it was that minor. So I had the surgery uh, to have my dog ears removed. Now you can't see too much. I'll try to show you. I'll show you again, because right now you're going to see gauze. This is gauze. This is my nipple. This is gauze. So I had the sides removed because after my first surgery, I had dog ears, and not little ones, big ones, like just hanging down like big footballs. And this side here, this side you can still see the blood's dried up. There's surgeon put surgical tape under the gauze. So he cut from the side to the back. And it feels like he cut my ribs. This side doesn't hurt too bad. This side he had to cut into the front. He cut upwards, he told me, and I didn't like that too much, but I can't really show you what he did. I'll show you later. But I think it's better than it was, getting all that fat and breast tissue removed. It's a relief. Um, but I think I went through a little bit of hell having it done. Because I was awake. I had local anesthetic. He used a local anesthetic. So when I go in there to have the surgery done, I had to lay on my side on the operating table, and I could see myself in the mirror. And I'm wide awake, and the doctor showing me, the surgeon, whatever doctor, he's showing me all these vials of anesthesia that he had, of the big needles. And he told me he'd be using those and injecting me with those to numb up my side, and which he did. But I'll tell you, the worst part of the surgery was him stabbing me with those needles, because those weren't little needles either. So I mean, I know what a big needle is. So that hurt, but I didn't say anything. I was just wanting to get the whole thing over with. Uh, so he told me to let him know, told me to let him know if I felt any discomfort or pain, then he would use more anesthesia. And I did. I felt like a scratching on my side. So I said, that felt like a scratch. And he said, oh, did you feel pain? I said, yeah, I guess so. It felt like a scratch. I don't know what it was. So then I could see him in the mirror, and he just, bam, bam, he just jammed that needle right in my side. I was like, hell, this is hell. But then once he got me numbed up, he began the surgery. Uh, well, I guess he already began the surgery because I felt some scratching. And he used the incision knife. Then he told me I was going to smell smoke, and it would probably smell bad. And he was using what I call a blowtorch, but it was actually a little soldering iron to burn out the fat from underneath my arm. So he burned it out, cut it out, and he burned it out. And then he showed me, which I didn't ask him to show me, but I think surgeons like to do that. So he's like hanging it, like hanging. He's like, hey. look at this, Hunter. This is what I took out of your side. What do you think of that? And that a lot? I'm like, yeah, could you not show me? I don't really need to see that because I just didn't think that helped me much go get through the surgery. Um, because, oh, you don't like that? And I didn't understand the conversation. It's just like, can you get this over with kind of thing. Yeah, that's great. That's a lot. It looked like it was about, I don't know. I don't know how much. Maybe that much under a dog ear. And a lot of fat, a lot of breast tissue. So, yeah, that was the one side. And then I could feel him sewing me back up. And then I felt discomfort, so I told him, yeah, I feel some pain. And so then he took the needle, and I saw him stab me again. And I felt him stab me again. It felt like he stabbed me in the rib. So then he did the other side, and I was bleeding on the way out. Because I was talking to the nurse, and I'm like, I put my hand under my arm, like, what the hell is this? Oh, there's blood. She was, oh, you're bleeding. Oh, yeah, can you do something about that? Because it was kind of a lot of blood. And it was kind of weird that, they just let you walk out bleeding. And she was just going to let me walk out bleeding. I said, could you do something about that? So she put more gauze. So I had to say, could you put more gauze? She goes, yeah, I'll try to clean that up. And then they're saying, well, don't take a shower, blah, blah, blah. Aftercare instructions. He didn't give me any aftercare instructions, but the nurse did. She said, don't take a shower or something like that. But there really wasn't much after that. So he asked, the doctor asked the nurse, can you give him some aftercare instructions? She went, yeah. And then she didn't. Really, I had to say, what's the aftercare instructions? But that's when I started to bleed. And I think the whole thing went out of my mind. And then it was, so the nurse asked the surgeon, so when does he come back? And he said, well, he doesn't. She said, oh, like I thought, where am I? Where did I get this surgery done? And she was like, okay, well, can, so he doesn't need to come back? And he goes, well, no, yeah, no, yeah. It was like, where am I? So actually, he said I didn't need to go back. The stitches would dissolve on their own. But I said, yeah, but it looks like my side, like I'll show you right here where my side looks like it might need to be paired again. Um, like I felt it was too puffy right here, so I said, well, maybe is that swelling? And the surgeon said, no, that's not swelling. But he just cut into me, and he cut like twice into my chest right here. I can't even show you guys yet, but I'll show you later. He made an incision upward here this way, and then he made one down under here, as he said he had to cut upwards. And then he sewed it together, and it looks like a Frankenstein stitch, and that's what I call it, the Frankenstein stitch. Which I don't know how that's gonna look. And I told him, what if I don't like it? And he said, well, you can, you got my number, give me a call. But the more I think about it, the more I don't want to go back there. So whatever it looks like, it looks like. Because I got sick after the anesthesia wore off. It took about 14 hours to wear off. So the count of the hours, like, I don't feel any pain yet. That's good. I don't feel any pain yet. Like 14 hours later, I woke up. Okay, I feel the pain. Little by little, pain came back. I felt it all. And boy, did I feel it all. Wasn't just the pain. I started getting physically ill. I felt like I had a severe flu, and I was nauseous, and every muscle in my body ached, and I couldn't figure out what the hell was going on. I took pain medication, which he forgot to prescribe. He said he was going to prescribe me regular Tylenol over the counter. He asked me, "Hey Hunter, have you heard of Tylenol?" I said, "Yeah, of course I've heard of Tylenol." And he said, "Well, you can get that over the counter." I said, "I know." aren't you gonna prescribe me something like with codeine or, well, do you want that? I said, yeah, I don't want just Tylenol. So he said he would do that, but he forgot or something. It wasn't there at the pharmacy. That was another nightmare. But I also had something at home from my gallbladder surgery. I had some oxycodone, so I took that because I was in so much pain. And then took some Motrin, and then something was making me really sick. Um, to my stomach, it felt like I was having a gallbladder attack, which those are severe. But I had my gallbladder removed, so I knew I wouldn't have a gallbladder attack. But I knew something was happening in that area, but it felt like it was shooting from my back to my front, or from my front into my back, like a stabbing feeling, and it was pretty severe. So I had trouble. I had all kinds of aftercare problems. I don't know. I felt feverish, like my body was burning up. Like I just touched my body and I could just fry an egg or something on my body. It was that hot. And then I felt something dripping down my arm. I thought, is that blood again? I felt under there, and it was liquid. So I thought it's discharge. So it could be an infection. I better go to the ER. At this point, I because I staggered to the car like a drunk. I was staggering through the yard all the way to the car, and I drove myself. And I was so out of it. I went to a stop sign. I remember that part. I've never gone through a stop sign in my life. Like, I was so out of it, I kept thinking, why did that car almost hit me? And I looked, I thought, oh shit, that's the stop sign. That's the four-way stop. But anyway, I drove myself to the hospital, and I just wanted to be checked out why I was so sick. They told me I had surgery, but I'm having all these flu-like symptoms. I'm throwing up. I'm shaking, literally like shivering like a chihuahua, like my chihuahua. And I have some discharge. I just want to have it all checked out. So the doctor put me on EKG. He thought maybe it was my heart. I knew it wasn't my heart. It wasn't my heart. They checked to see how high my fever was, and asked do I want my dressings changed. Then they forgot to change them. They said They said your dressings changed under your arms or the top where I had the revision. I said, yeah, sure, they should be changed. By the time I left there, they just had forgotten. I said, you guys forgot. And I said, oh. I said, can you just give me some gauze and some tape or whatever? So they gave me that. I was feeling a little bit better because they gave me something for pain, or the middle of my chest, that's where I was having all this stabbing pain in the middle of my chest, which is unusual. And that helped. So I felt better. And by the time I got home, I was starting to feel sick again. And like I was going to throw up again, nauseous, feverish, temperature was 102. That's not normal, but it's not that severe. But I was kept an eye on my temperature. What else did it help? I just had to eat. I was afraid to take any pain medication after that. Like no more oxycodone, no more ibuprofen, which I know I needed pain medication. It felt that bad. But I was afraid to take it, so I didn't take anything for pain. I just felt the pain, and then I had the muscle aches and pains. And I'm pretty sure all this is from the anesthesia. So I must be allergic to anesthesia. So I took Theraflu for the muscle aches and pains just to knock my ass out to go to sleep. I could only sleep 2 hours, which I felt like I slept 8 hours or so. I look at my watch and it'd be 2 hours later. If I only slept for 2 hours, I could sleep 2 hours at a time. Get up and try to take some more Theraflu. So this went on for a couple of days. I was sick for a couple of days over some minor surgery. At least that's what the doctor called it, minor surgery. I could hardly get out of bed because this side here, which I showed, this side I think it looks the best, because he didn't cut up into the front like he did the other side. But it sure as hell feels like he cut into some major nerves. I don't know. It feels like it's never going to heal. But who knows? Probably will. I mean, it's only been a few days. Um, what else? Well, that's my recovery. So, oh, my back. So I was walking to the bathroom yesterday, and I was feeling my back because my back's really sore from being on my side, half hour each side, laying on my side where he's doing surgery on one side. So my whole back was kind of messed up. So I'm just feeling back there, like I was kind of hurting back there, and there's a lump. I'm not kidding, the lump is about that big. And it went across my spine. I'm like, now what the hell? So I asked Aaron, I said, do you see this? I feel it, but I can't see it. He goes, yeah, it looks like a bone sticking out of your back. I'm like, a bone. But I didn't believe it was a bone. I said, it doesn't really hurt when I push it. It was actually fluid buildup. I could tell. I pushed on it, felt like it was a hard fluid. I thought, what's this now? All because I had surgery. All because I had to have a top surgery revision. So I looked that up on the internet, what that could be, and that's what it said. Edema or some fluid buildup from having surgery, but that's from your incisions, when you have incisions. So I thought it's probably just from being on my sides. Um, Plus, I don't know. The drive was 2.5 hours there, 2.5 hours back. So it's probably just a lot of trauma that I was going through my back. So the next day that was okay. I felt it and it's gone. So thank God that's gone. Um, so right now I'm just waiting to heal. I'm just waiting to see for this pain to go away in my right side, and then I want to come back on here and show you guys. I figured I'd share. You'd share with me, right? So I figured I'd share with you guys. I hope it didn't scare anybody. That was not my intentions. It's just me. I have bad reaction to anesthesia. I had my gallbladder removed, and I remember I was pretty bad off then. I'm not sure if I was nauseous and all that, but I was in a lot of pain. But maybe I'm just not remembering too much about it. But this seems to be one of the worst. I had a hysterectomy, and they kept me in the hospital for 4 days, 4 or 5 days. And they kicked me out because they said, if you can't leave after 5 days, then we put you in rehab. And I'm like, oh, I can walk. I can walk. Don't put me in rehab. Um, but yeah, anybody when you first come out of surgery, you don't feel so good. This was local anesthesia, so this was different. And I never want to have to. Next time I have to have any type of surgery, I want to be put under. Definitely don't want to have any local anesthesia, unless it's for a toothache or something. Or not toothache, but like removing like a tooth or something. I had that done. I don't remember feeling sick after that, but this was a lot of. He gave me a lot of shots. So please subscribe if you're new to my channel and you just want to know what it looks like, the whole thing. I'm just gonna show you again. Here's what it looks like now. But I'm also laying back, so it pushes the pillow pushes the fat like towards the front. This side I was worried about because it was a little puffy. But he said, oh, he couldn't cut any further back, to make this a little smaller. But I got a gauze on it too, but I didn't really like it. It was a little more puffier on one side than the other. But he said, well, pinch your side, Hunter, and then try to lift your arm. See, you can't do it. So if he were to cut any more on that side, I wouldn't be able to lift my arm. That's what the first surgeon said, but that wasn't even true. So who knows? Um, I'm gonna go. I've kept you guys long enough. Thanks for listening, and hope everything is well with you. And if you decide to have top surgery, hope it goes better. Remember, if you're gonna have just a local anesthesia, you might want to reconsider, or you're gonna do a lot better than me. If you've had it and you did well, you did terrible, let me know. Put in the comments below. Peace. I'm gonna go. That's a wrap.